One of the messages from last night was that cancer's very variable. It's constantly shifting. It's highly variable. I think it's helpful for people to understand that we're not looking for a single treatment. And even some of the really new stuff that hits headlines, like immunotherapy, ideas of targeting the tumor microenvironment, stuff we were talking about last night, it's unlikely, I think, that we're going to see those as acting as standalone, one-off, we're done, we're cured therapies. And I think it helps if people approach cancer with a realistic sense of, okay, I'm going to need a load of different, I'm going to need to go through a series of tests, of imaging, of biomarking, but I'm going to have to give the clinicians an opportunity to build a molecular picture of my disease so that when they try to tackle the problem, they can target it, they can tailor the right combination of therapies. That's going to take a little bit of patience, perhaps. And we've got to embrace early detection with a bit less fear. We've got to embrace some screening ideas with a bit less fear. You know, nobody wants to hear it, that you've got cancer, but it's better to hear it sooner rather than later. And I think by engaging with people, we stand a better chance of people approaching the idea of, okay, I better find out whether this is brewing, whether this is going to be a problem sooner rather than later. And when they engage with the therapy side of things, maybe they need to engage with, okay, there's going to be a journey here that doesn't involve getting stuck into treatment immediately. And maybe that will help people be more realistic. But I think from the scientists and clinicians side, having this conversation allows us to talk more effectively to people about what it is we do, what it is we might be going to do, what difference it might make. Communicate statistics, numbers, chances, probabilities, communicate why I'm doing this battery of tests and scans, maybe communicate why I'm going to do it again. It's not because I got it wrong in the first place, but because the disease's capacity to shift and adapt to what you just did means that maybe I have to retest, re-image, maybe I'm going to change therapy. That doesn't mean I did the wrong thing or that it wasn't working, it's just that the goalposts have shifted as the disease responds. Cancer is not going to be an easy thing to tackle, I think. And so the more realistic and the more sophisticated we are in understanding, both sides need to engage so that in the middle, everybody has the right expectations and engages in what could be quite a sort of complex, dynamic treatment regime in 20 or 30 years.